Kavya.
Thank you. Now we will move to the next speaker, Ms. Anne Nguyen. And she, sorry again for the mispronunciation. She is going to talk about accessing reproductive health care services for women with physical disabilities too in Vietnam. And she is currently doing her PhD at Monash University, Australia campus. She has a physical disability due to polio. Prior to coming to Australia 7 years ago, she has lived in Vietnam, where she worked with and researched on people with disabilities for more than 10 years. Please, Ms. Anne, you have the floor to share your experience. Thank you very much.
Thank you. Hi, everyone. I would like to share my screen. Okay, on good.
Yeah, we can see it clearly.
Okay, that's good.
Yeah.
Thank you.
We cannot hear you, Anne.
Yeah, can you please unmute your mic?
Anne, please unmute yourself. We cannot hear you.
I would like to say thank you, everyone, today and sharing some of my initial practice in Vietnam.
Yeah, I think you need to unmute the mic so we can hear you.
Can you hear me now?
Yes, now it's perfect. Please.
Okay, thank you. That's good. I'll share my screen again. Okay, is it clear?
Yes, please continue. Yes, please.
That's good. Thank you. Thank you for having me today, and say hi to everyone from Australia. And I'm happy to be here today and present some of my initial findings from my PhD research that I conducted in Vietnam entitled Access to Reproductive Healthcare of Women with Physical Disability in Ho Chi Minh City, Vietnam. And here is some of my outline that won't be long. As you know, that access to reproductive rights for women with disability is for a basic human right and global public health. That's also mentioned in CRPD in the Article 5 that people with disability have the right to access to health without any discrimination. And also WHO mentioned in Sustainable Development Goal 3 that healthy life and promoting well-being for all at all ages. And reproductive health in Vietnam, Vietnam is progressive in terms of reproductive health. And most people can easily access to contraception and reproductive health are openly discussed in public and in the family. And recently, several government policies actively promote the reproductive health rights. The recent statistic that I got that the contraceptive use in Vietnam is very high. About 80% of married women have the age from 15 to 49 use some form of contraception. However, these seem ignore the people with disability. The division in 2013 identified that the need for reproductive health care strategy addressing healthcare needs for vulnerable groups. However, the national standard guidelines on reproductive health care services currently don't have standard guidelines for people with disability. And people with disability did not specifically discussed in any reproductive health policy initiative. in Vietnam, we not have the statistic on people with disability. So the latest number that I got in 2015 that people with disability in Vietnam occupy about over 6 million people. And about 1 in 5 households have 1 or more people with disability. Most of them live in rural areas and living with poverty and impacted by disability, and they also have limited or no education. And the situation of Vietnam for people with disability in Vietnam is not hopeful, as the high rate of unemployment, about 1.69 times more than people with non-disabled. And over the past decade, Vietnamese government has made the significant effort to improve the quality of life for people with disability. For example, they had started the CRPD in 2007 and ratified it in 2015, and to seek to recognize the rights of people with disability. And recently, they just issued the law of disability in 2010, and it's enacted in 2011. They identified the rights of people with disability. However, in the document, there's no mention about rights related to reproductive health. So my research is explore the women with physical disability experience of accessing to reproductive health care in Ho Chi Minh City, Vietnam. So as you can see on the left side, that's the map of Vietnam, and the right side is the map of Ho Chi Minh City down to the right side corner. So the data collection, prior to my data collection, I take the trip to visiting some healthcare services. They included the private healthcare services, international, and also public healthcare services to see what's going on there. And the second trip I make in June and July for in-depth interviews only. And my participants include 20 women with physical disability, 5 key informants, and 5 healthcare providers. My research also reviewed some of disability law, health insurance policy, family planning policy, including family planning health report, and some policy related to reproductive health. And some of my initial findings from the participants share that they have mostly have positive experiences. The infrastructure improvement, including the ramp, lift, and wheelchair at the healthcare service are available. For example, at P, she said, generally it's very accessible. They have ramps for wheelchair. They have elevators at almost buildings, so patients can get access to any level. And another participant, Tan, she said that also they have available manual wheelchairs there. I can borrow it. If I cannot use by myself, a volunteer there is willing to help and push me to the consultation room. So that's very good. As you can see here, the first picture that I took at the district hospital, that's the ramp that has been made for wheelchair user. And the second picture here, I took at the international hospital, that the wheelchair always available in front, so the patient can come and use it. And the last one is the elevator that has made in international hospital, that's for public use. So another positive change is government healthcare card for people with disability entitle them to reduce fee or even free services depending on the assessment for their capabilities. At tools, a wheelchair user, she say, I got a government healthcare insurance. I didn't pay anything. It's free, 100% for me. So the picture here is the healthcare card. Another positive here, experience was shared by participants that healthcare providers are more sensitive and knowledgeable about people with disability. At TCA, the access to Bình Thạnh Hospital, that is a public one. At Bình Thạnh Hospital, where I register, they are very nice and friendly. Every time I go there, they always ask me if I need a wheelchair or a support. They also helped me to register at the counter, and absolutely, I got a priority. And the doctor is so knowledgeable. He advised me clearly about my case as a pregnant woman with physical disability. So this factor appear to support people with disability to take good care of their health. However, some of women with disabilities feel challenging with periods when accessing to healthcare services. The main barrier is the toilet. Some toilets in public hospital were inaccessible for wheelchair user. For example, Đinh said that at Từ Dũ Hospital, some toilets are inaccessible for wheelchair user. One time, my husband had to carry me to the toilet. Then he waited for me in the front of the toilet. Once I had done, I called him to come back and take me out. Then the people there screamed at him, "What? Why do you go here? This is for female only." Then he had to explain that my wife is here, she cannot walk. So that is a problem that some wheelchair users that face at the Từ Dũ Hospital. And another negative experience is the parking for motorbike. This is far away from the main entry, or even not accept the three-wheel motorbike. As Như and then she has that problem. You say that the parking is a little bit far away the main entry. The entrance to the parking is so too narrow for the three-wheel motorbike, so it's hard for her to get in. And another one say that when I went to Chợ Rẫy Hospital, they denied my three-wheel motorbike. They said my one occupied as much as two motorbikes, so that's why they didn't accept her motorbike. So this looks like ridiculous, isn't it? So almost all women with physical disability had positive experience when accessing to healthcare services. This is likely that related to the government recently implemented disability law, and which has brought about a number of changes related to healthcare, including allowances, reduced rates, and new infrastructure. However, not all people with disability are benefiting equally due to differences in the capacity of local government to operationalize the law. So women with physical disability access to reproductive health care could be further improved by improving the capacity and knowledgeability of the local law officer. So, thank you.
Thank you. Thank you so much for your presentation. And this is really great. And thanks on time. We know like for the accessibility challenges, that's the key where they can get the access, and people are like not going out of their home just because of the infrastructural barriers, communication barriers. So this you have rightly mentioned and showed your examples. We are really happy to have you in the panel, and we'll definitely share some of your experiences with other countries. We just move to the next speaker, a special intervention by a youth. That's the most important one. So we will just quickly move to Pyong New